Hi everyone, I wanted to show you the tray setup for a well woman exam. So we as adults should get a physical about once a year, and for a woman, during her physical, she'll get her breasts examined for any masses. She'll get a pap smear and also a Hemocolt test to check for any possible blood in the stool that could be indicative of colorectal cancer. So here are the supplies that you would set up on the tray for the provider. So we have here, I'd like to just point at everything. So here's some gloves for the provider, and we have here also the vaginal speculum and the light that goes inside so we can illuminate inside of the woman's body to see the cervix for any abnormalities. And then we also have the brushes for the provider to use to collect cervical skin cells from the patient. So this one, if the woman has a lot of discharge, we can use this one to remove the discharge. And then here, these are some good brushes that we can use to obtain cervical cells. And then once the provider has a sample, they would hand this off to you, and you would swirl it inside this jar right here. It's called the ThinPrep. And you would swirl the brushes to get the cells into this bottle, and this is the bottle that you would send off to the lab. So obviously you would want to label it with the patient's name, date of birth, the date, and your initials. Okay. We also have here, this is gel, just in case. Usually the providers, they put lubricating gel on the end of the speculum for ease of entry. And also we have here the Hemocolt card that we would use to check the woman for colorectal cancer. So if you were to open it up, right, the provider would, with their gloved finger, put some stool samples on these two windows. And then you, on the other side, you turn it over, open this up, and you put down 3 drops of this. So you'll put a drop here, here, and on the control. And if the card turns blue at all, then it's evidence of blood in the stool, and the patient might have to get a colonoscopy. So also, generally a woman during her physical, she'll get an order for a mammogram. She might get a colonoscopy order. Definitely blood work to do, and any other preventative testings that the provider thinks is appropriate for the patient. So besides this tray, you would also want to, on the exam table, you want to pull up the stirrups. And I have here, this is a chuck to put down on the table, just to create sort of a barrier between the woman and the table. And I have here, this here is a chest gown so that the provider can do the breast exam. And then here is a gown for their bottom half, just so they can be a little bit covered up and not so cold in the exam room while they're waiting for the provider. And we have over here, sometimes when patients come in, they have signs of an STD. So this one we can use to check if they have herpes, but there's also a blood test. And this one you can use to check for gonorrhea, chlamydia, if they have discharge. But typically we get their urine to do a gonorrhea or chlamydia test. And nowadays, a lot of the tests for STDs are through blood, except for the herpes. That too is, we got to swab a lesion to confirm whether or not it's herpes. But there actually is, when I think about it, a blood test. So once the provider is done with the exam,